Four stages of syphilis. Yes, there are four stages of syphilis. And what is syphilis? Syphilis is a sexually transmitted STD. All right? Yes. And syphilis is more dangerous than HIV in one or two essence that I'm going to share with you. Remember that HIV and AIDS does not kill you. It is an opportunistic diseases that do. But syphilis could actually cause more harm. Stick around to understand how that happens, okay? So we've said syphilis is caused, the causative agent is called Treponema pallidum, okay? It's sexually transmitted. How can you get syphilis? How can you get syphilis? Number one, sexually, okay? Vaginally, sexually, either your vagina or in your penis, okay? Through anal sex or oral sex. So it's vaginal sex, mouth sex, or anal sex. You can get syphilis, right? The other way you could get syphilis is through blood transfusion. Let's say someone had syphilis, they donated blood, you were given that blood, you could contract syphilis through that way. But that one is very limited because we always clean our blood before we give the recipient. Thorough screening, right? Very nice. The other way you could get syphilis is this is called congenital syphilis. We'll talk about it as we continue. Very nice. So syphilis is divided into four stages. Number one is called primary syphilis. Okay. So primary syphilis happens between the 10th day all the way to the 90 days. Okay. And how do you know you are on primary syphilis? Number one, you've got a chancre. A chancre is like a blister that appears in the place where the bacteria was deposited. If the bacteria was deposited in your mouth, you're going to have the blisters around your mouth. If it was deposited in your vagina, you're going to get it there. If you got it from the vagina, it's going to be on your penis, the head of your penis. If it was deposited on your anal area, you're going to get it. You're going to have that chancre blister on your anal area. That chancre might actually disappear, right? It disappears, and when it disappears, now that one brings us to secondary syphilis. Okay, so secondary syphilis, it may take months, but for you to enter secondary syphilis. So in secondary syphilis, you're going to be having skin rashes. Yes, you're going to be having skin rashes. The other one is mucous purchases. Very nice. And then the other one you might be having most like what growing in genital or anal areas. Okay, highly infectious. Okay, whether you are in primary or in secondary syphilis, it is highly infectious. Are we together? Highly infectious. So what are other signs that you might be having syphilis? You might be having sore throat, you might be having fever, you might be having swollen lymph nodes, muscle aches, fatigue, and patchy hair losses. Patchy hair losses could be a sign that you're suffering from syphilis. You are fair, you are having fatigue, you are fair, you're having some fevers, you are taking some what do people take mostly? Some cetirizine and stuff like that, but you don't know that you're suffering from syphilis. So that is secondary syphilis. What is latent syphilis? So latent syphilis, this is the hidden stage of syphilis. Latent syphilis. This is the hidden stage of syphilis. This has no visible signs. Yes, when you're on latent syphilis, you have no visible signs. You literally have no visible signs. There's no chancre, there's no fever, there's no nothing. But it is still very positive in your blood. You're still positive for blood. How long can it last? It can last for over years. Then we have early latent syphilis and we have late latent syphilis. Early latent syphilis is below 1 year. Late latent syphilis is more than 1 year, right? Late latent syphilis is not infectious. It's not much infectious. Then let's go to tertiary syphilis. Tertiary syphilis, now this is where you understand that syphilis is actually more dangerous than HIV. Why? Because it appears between 10 to 30 years. Yes, you've been having syphilis for 30 years, and after 30 years is when it's giving you problems. After 30, 20 years is when syphilis now is giving you problems. Why is it giving you problem? Because it starts to damage your skin, your bones, and your organs. When your bones are targeted, when your organs are targeted, now you're starting to have organ damage and stuff like that. The main issue is when it attacks, when it becomes, it evolves to cardiovascular syphilis. Cardiovascular syphilis damages the aorta. Aorta is the main what? Is the main artery? Yes. Pulmonary vein is the main vein. Aorta is the main artery. So when it is damaged, you start having cardiovascular problems. Cardiovascular problems such as valve disease, aneurysm, and things like that. And now you could have stroke. Yes, you could have stroke. And that stroke could lead to death. Now you see, now this is more dangerous. HIV doesn't cause these serious problems, but now syphilis will, right? And you should get tested. Then there's something called neurosyphilis. Neurosyphilis also appears and it affects the brain, the spinal cord, and what does it cause? Neurosyphilis causes blindness. As you go blind after 30 years, you go blind. It's because of syphilis. The other one is that you get paralyzed because we say syphilis can be able to attack your spinal cord. So you are paralyzed out of nowhere because of syphilis. You get dementia, stroke-like symptoms. Okay, let's go to special case of syphilis, what we call congenital syphilis. Congenital syphilis is a kind of syphilis that is passed from an infected mother to the baby during pregnancy, especially during birth. Your child is going to go blind, right? Yes, syphilis has a chance of making your child go blind, okay? And it causes stillbirth. The reason why you have stillbirth is because you have syphilis. But how do we prevent this congenital syphilis? Number one is that when you come to the hospital, we give you something called ANC profile. And on ANC profile, other than us testing HIV, we also do syphilis because we understand there's something called congenital syphilis. Congenital syphilis can cause serious problems such as anemia, blindness to your child. We're together. So is syphilis treatable? Yes, syphilis is a bacteria and it is treatable with penicillin. That is not my part to talk about, but I think it's benzoyl penicillin, doxycycline, and ceftriaxone, depending on what stage you are, right? Depending on what stage you are. So what are the available tests that you can do to know you have syphilis? Just we always say 3 tests: urinalysis and swab, and now the VDRL test. VDRL confirms if you have antibodies belonging to treponema pariform, right? Then you can do TPHA or you can do syphilis antibodies, okay? We do that at our lab, right? My number is always 0740 250 696. For any question about syphilis or where to get tested, you can come and get tested. Early, when you detect a syphilis on early stages, treatment is very easy. But if you delay, treatment becomes very hard and you could go mad. Yes, syphilis can cause madness. You could go mad. So go there, get tested, get treated as early as possible, right? Transmitting syphilis is not a flex. It should be jailed. My name is Peter Gomba. I'm a certified medical biotechnologist. I do test and interpret the same. I'm located in Zambezi. My number right here, 0740 250 696. See you on the next one.